to the To Your Health podcast, your go-to source for everything health, fitness, and the latest in medical insights. I'm your host, Rhonda Alford, and joining us today is Dr. Tyler Tewilliager, a foot and ankle surgeon at Gulf Coast Orthopedics and Terrebonne General Health System. Welcome to the show, Dr. Tewilliager.
Thanks for having me. Excited to be here.
Well, we're glad you could come today. Can you tell us a little bit more about yourself and what your role is going to be at Gulf Coast and Terrebonne General?
Yeah, absolutely. So I'm originally from Michigan, where I was born and raised. Did all my school and my residency in Ohio. Worked my way out to Colorado for a fellowship for a year. Was actually in practice for about 2.5 years before making the move down to Louisiana. And so far I'm loving it. Been here for just about 2 months now. And all the people are great. The food and culture is amazing and having a great time so far.
Yeah, I don't think you're going to find a better place for food.
No, certainly not.
Food and people. And it's a lot warmer down here.
Yeah, 100%. I'm getting used to the heat. I think I'm finally acclimating a little bit, but if you see me sweating walking around, sorry.
Well, it'll take a minute for you to get used to it, I'm sure. Well, let's get started with our conversation today about, when would somebody need foot and ankle surgery and how you got into it. So what led you to the specialty of foot and ankle surgery?
Yeah, absolutely. So everybody, has to walk around, if you have issues with your feet, you certainly know about it because it's miserable. I myself have had plantar fasciitis multiple times and self-treat, and it's one of those things that it can be debilitating. Something is, what seems so simple can really affect people's lives, and it's nice being able to take these either simple things or large deformities and correct them and get people moving and hopefully pain-free again.
So what are the most common injuries or conditions that you treat?
Yeah, so I treat pretty much a huge spectrum of different things. Definitely the most common things I see are plantar fasciitis and Achilles tendonitis, really just overuse type injuries that are chronic and tend to build up over time and eventually get to that point where it's just driving people crazy and they end up in the office. But the range from simple things like hammer toes and bunions to large deformities where people can't walk because their foot's turned completely sideways. So really the full spectrum of foot and ankle.
When would somebody have to consider seeing a specialist as yourself or just going to their regular doctor?
Yeah, so really something as small as just an acre of pain, I'm happy to get them in and see them. Really, there's nothing too small. If you're worried about it and it involves your foot or ankle, I'm happy to get somebody in and see them.
So are there some types of foot injuries or complications that people shouldn't ignore and they should come to see you right away?
Yeah, definitely. So I think anything more than just like a minor sprain or injury is definitely something that you should be evaluated for. It's always safe to rule out a fracture, and really things like ankle sprains especially, you can't always just walk them off. That's kind of an old school mentality, but really they can lead to issues down the road. So something, that just seems minor but is lingering for more than a week or two is worth getting checked out.
And how do you tell the difference between something that can be managed conservatively without surgery or something that needs to have a surgical procedure?
Yeah, a lot of that just depends on the examination of the patient. I look at x-rays, advanced imaging like MRIs and CT scans. Oftentimes people end up in physical therapy depending on what it is. I always try and exhaust everything conservative before, doing anything surgical. And nobody wants to be rushed into surgery, and a lot of things can get better without surgery, but eventually some things do end up needing surgery, but I like to make sure we've exhausted everything else before then.
What type of non-surgical procedures do you perform?
Yeah, so there's a lot of things we can do. We can modify shoes with orthotics. Physical therapy is something big we lean on because a lot of things like aches and pains, strains, muscle injuries are things that tend to get better with physical therapy. Things like arthritis, sometimes we just do injections periodically, anything to kind of delay surgery and improve symptoms.
What's the most common procedure that you perform?
Oh, that's tough. Like I said, foot and ankle is a pretty wide spectrum of things. I think Achilles injuries are, up there with number one, where people get these big, large bone spurs in the back of their heel that lead to chronic injuries of the Achilles tendon where it gets thick, aggravated, and sometimes need to be repaired. But trauma is also a big one. It's the summer, these warm months, people get injured with ankle fractures or foot fractures. So I see a ton of those and end up fixing a bunch of those as well.
So what are some misconceptions that people have about foot and ankle surgery?
A lot of people think that, they have to live with the aches and the pains in their feet, but really we have a lot of options Things like ankle pain, sometimes we go in there with a scope and clean it out. There's things like total ankle replacements these days that have really progressed over the past 10 to 15 years and are really excellent for 10, 20 years down the road and provide people a lot of relief and can keep motion. So that we have a whole bunch of new advanced technology that really is aimed at specifically the foot and ankle, where you can treat specific arthritis, and whether it's the big toe, the middle part of your foot, or your ankle, we have a bunch of treatments for that.
I've never heard of total ankle replacement. Is that something new or?
No, they've been around for a long time, but the technology has really progressed over the past 15 years where, instead of lasting 1 or 2 years where the original implants last, we really can see good survivor rates of the implants for 10, 15 years down the road, which is great. Nobody wants to go back to surgery after, something like that. And the goal is to keep motion, relieve pain, and ideally not have to go back and talk about doing revision surgery within the first few years.
That's amazing.
Yeah, they're very cool implants.
What type of recovery period is involved in that?
Yeah, typically I'm pretty aggressive in terms of getting people moving again. Nobody likes to have downtime, so oftentimes you're looking at a few weeks no weight on it while your skin heals up, and as soon as your skin's healed and sutures are moving, I have people walking on it, really out of a boot by the 6-week mark, and aggressive physical therapy from there. It's normally a pretty easy recovery comparatively to some of the older procedures we had for ankle pain.
What do you recommend, or how early is it to intervene, to have early intervention before you have foot and ankle pain?
Yeah, certainly it's never too early. I think, there's a bunch of different maintenance things you can do to help prevent these injuries. Stretching is by far the most important, especially when you're looking at the Achilles tendon or injuries of the Achilles tendon. You can never stretch that out too much. There's a certain demographic, we call them our weekend warriors, that unfortunately end up in the office with Achilles tendon tears, ruptures, or just tendonitis of that. And a lot of that can be prevented just by stretching out your calf muscles and being aggressive with it. That's one muscle that you can't overstretch, you can't overdo it. If you're stretching it out before activity, that's the best thing you can do to prevent having to see me for something worse.
What exercise would you recommend for stretching?
Yeah, really, it's just anything focused on the calf. So if you have one of those incline boards or using a wall, a chair, I do this all the time. Just standing in the office, you'll see my foot up, pushing against something, and I can feel a deep pull in my calf. That's how you know you're stretching enough.
Okay. Well, it is coming up on that time of the year again, football season and other sports. So what are some, do you see sports injuries, and what are some that can affect the foot and ankle?
Yep, certainly. So sports injury is very common. So some of the more common ones we see, sprains of the foot, something called Lisfranc's ligament is a very common one we see with football. Really, it's just an injury that can cause a significant amount of pain and instability, and almost always needs to be addressed surgically, especially in our younger athletes, just to limit risks down the road of instability and arthritis. So those are ones you definitely don't want to wait on. See a ton of lateral ankle ligament injuries or severe ankle sprains. Definitely something you don't want to wait on, especially if you have a severe one. If you can't take more than a couple steps or it's lingered more than a week, it's definitely something you want to see somebody for to get addressed, because the longer you ignore them, the worse off you are going to be down the road, where you can have chronic instability where your ankle just wants to give out all of the time. The stats, something like 50% of ankle sprains go on to another ankle sprain. So the earlier we catch that and treat that, the better.
And you mentioned weekend warriors. I know there are lots of those out there. So what types of injuries do you see from those types of people for foot and ankle?
Yeah, it's always, the middle-aged man that still thinks they're in their prime playing basketball, that's going up to get a layup, comes down and feels like they got kicked in the back of their calf, as the classic Achilles tendon rupture. And that's the most common thing we see in that demographic. But we also just see just general wear and tear, tendonitis, plantar fasciitis. All those things can flare up if you're not getting your body stretched out and warmed up prior to doing these things.
Yeah, and all of them can be treated if they come see you and do a little therapy probably.
100%.
Well, I know diabetes affects foot health. Can you tell us a little bit about how you treat diabetic patients?
Yeah, 100%. So diabetes itself isn't the bad part of it. It's really the neuropathy that comes with uncontrolled diabetes for a long period of time. That's where we see things like ulcerations and infections that unfortunately lead to amputations. So getting evaluated, keeping the sugars under control, and catching ulcerations and wounds early can prevent most amputations from happening. Unfortunately, when they do get bad, if you catch it early, we can still kind of limit the damage. The goal is always to, what I do is called limb salvage, is try and avoid a higher up amputation, where sometimes that means you lose a toe, but you still have your leg. And that's really my focus, is to kind of limit the damage, catch things early, and by being vigilant and having regular follow-ups, we can do that.
Well, that's very encouraging. Is there a special type of shoe or well, let's talk about shoes first.
Yeah, this is probably the most common question I get anytime somebody comes and sees me who has a chronic injury or just wants to be more active, is what shoes do I recommend? And the bad answer is there's not a specific brand that I recommend. I recommend 3 really things you should look out for in a shoe. 1, you want a stable shoe that you can't fold in half like that. So I take every shoe whenever I'm shopping for a new one, try and bend it in half. You shouldn't be able to do that. Okay. Other thing is you twist it side to side. You should have a little bit of motion, but you shouldn't be able to bend them like this. And the third final thing I do is squeeze the heel. It should have a decent little heel support in there. You shouldn't be able to bend that all the way in. If it meets those 3 criteria and it's a comfortable shoe that you can walk around in without pain, then it's a great shoe. You know, there's all these great brands. There's Hoka, Brooks, Asics. There's a million different brands that make nice shoes, but everybody's a little bit different in their foot. What works for me might not work for you. And the worst thing I can do is say, no, you got to get a Hoka. You try it and you hate it. It's really very patient specific, foot type specific.
But there's lots of choices available.
Yeah, there are. There's, you know, you really can't go wrong if you meet that 3 criteria and it's comfortable.
So what do you have to say about high heels?
Ooh, keeping me in business. No, if you're going to wear high heels, you know, obviously high heels do set you up at risk if you wear them a long time. You're at risk of injuring your ankle. You get a lot of ball of the foot pain, and you can even make bunions a little bit worse with them. But if you're wearing a heel, something preferably with a little bit of a wedge is the way to go, just to be safe. But
is there a certain height that you shouldn't go over? You know,
it's, you know, what you can handle. Knowing that you're probably going to be in a little bit of pain afterwards, and, you know, I never tell somebody they shouldn't wear something. Just keep me on speed dial if you're going to wear your 5-inch stilettos.
Some people still do. I think wearing flats has become a lot more acceptable lately, and comfort is king now. So,
yeah, 100%.
So you mentioned bunions. Tell us a little bit about, you know, some women have those because of wearing high heels. I know that's a concern. How do you treat those?
Yeah, so bunions are tough because really there's only 2 options. 1 is wearing wider, comfier shoes, or 2 is surgically correcting them. They make all these little gadgets, and none of them really straighten out your bunion. You know, you see all these different braces they advertise online. None of those are addressing the root cause of it, which is really a bony issue where your bone is swinging out and causing that big old bump on the inside. There's a bunch of newer surgery techniques for these, and even some minimally invasive where you can do it with just a few poke holes, which is, you know, kind of newer technology that is really nice for people who don't want a scar. I will say bunion surgery is very painful, so if it doesn't hurt, I would avoid getting it fixed.
Oh, really? So the recovery period is...
Yeah, it can be a painful recovery. So I always tell people, you know, it is not cosmetic surgery. It is elective foot surgery, and it needs to be painful for you to have surgery for it, because I can certainly make it painful afterwards.
Oh, well, that's not good. All right. Well, how can somebody get in touch with you for an appointment?
Best way is calling the office and getting on the schedule, or going to the website and we can get you in. And, you know, my schedule's wide open right now. I'm in Houma Mondays, Wednesdays, and Fridays, and Morgan City's on Thursdays.
All right. Well, thank you so much for being with us today and sharing that helpful information.
Thank you very much for having me. Excited to be here.
For more information about Dr. Tyler Tewilliager and foot and ankle surgery, please visit tghealthsystem.com. Thanks so much for joining us, and please don't forget to subscribe to our podcast where you get your podcast.